When your child is scheduled for a procedure that requires general anesthesia or sedation, it is important to follow these instructions so the procedure won't have to be delayed or rescheduled. A nurse will call the day before surgery to review your child's current health status, the time of the procedure, eating and drinking instructions, and when you and your child should arrive. Usually, it's about 2 hours before the procedure. Please have a parent or legal guardian with your child the day of the procedure. If that's not possible, ask the nurse how to handle the paperwork. Your child should not eat foods for at least 8 hours before the procedure. This includes gum, cough drops, and hard candy. Formula and milk should not be given to your child for at least 6 hours before the procedure, and breast milk should not be given for at least 4 hours before the procedure. Your child should not drink clear liquids for at least 2 hours before the procedure. Clear liquids are liquids you can see through, like apple juice, Sprite, Pedialyte, or water. If you give your child liquids later than the approved times, there's a chance the procedure will need to be canceled or rescheduled. If your child takes any medicine or uses an inhaler for asthma, it's important to tell the nurse everything your child takes. There may be some medicine that we do not want you to give your child. For approved medicines, please give the correct dose to your child the morning of the procedure with sips of water. If your child usually takes medicine with food or applesauce, let the nurse know before you give the food. If your child uses an inhaler, please have them use it in the morning. Ask the nurse for instructions. On the day of the procedure, dress your child in loose, comfortable clothing and remove all jewelry, body piercings, hair braids, and extensions before coming in for the procedure. When asked by the care team, it is important to tell them if your child has been ill or has had anything to eat or drink. These things can cause serious harm to a child while under anesthesia. If you have any questions, please call 614-722-5200 from 8 a.m. to 5 p.m. Monday through Friday. In the evenings and on the weekends, call 614-722-4100 and ask the anesthesiologist on call to be paged.